Well, good morning. It's Monday, January 7th. I'm Allison DeCastro.
And I'm Molly Faye. On today's show, it's time to think outside the box for dinner.
Plus, turn that exercising resolution into a revolution by helping others today.
And a baby shower that's turning into a storm. The Morning Blend starts right now. We're waiting to go.
Let's go.
Let's sit down.
Let's go ahead and sit down. After you.
There we go. Usually we have a little show open there that gets us into our
You're
guests.
seeing
But
everything
today we're just going to go ahead and sit down.
Absolutely.
How are you guys today?
Excellent. How are you?
Good morning to you both.
Yeah, we're starting off the show right away. We have some breaking news that's coming up. We're going to see the swearing in of our new police chief in just a minute. But we're going to start our show off today because many people get a sinus problems and they fear that a solution will put their life on hold while they recover from all that those sinus issues. We all know somebody like that.
Especially this time of year, we're thinking about our sinuses. But a new advanced treatment will get you back on track the very next day. These days, many businesses, want to think they're advanced. But one medical practice here in our area is truly living up to that concept. It's even part of their name.
That's right. They are the Advanced Ear, Nose, and Throat Specialists, and that says it all right. With us this morning are Dr. Madan Kandula, a board-certified ear, nose, and throat specialist, and Dr. Gwen Kandula, a certified doctor of audiology. Thank you so much.
Thank you for having us. Good morning.
Good morning to you both. We read in our intro there where we talked about a lot of businesses saying that they're advanced. Everyone wants to think that they're on the cutting edge, especially when it comes to the medical field. That's part of your name. Do you feel like that's an important part of your company's name and what you do?
Absolutely. Yeah, that's one of the key parts of what we do. What we do is care for patients. The advanced part of things allows us to try to deliver that care better. And so our whole reason for being is trying to deliver the utmost care. So one of those things that you mentioned was the sinuplasty, which is a new procedure that we introduced to Wisconsin that allows people who have sinus problems to get better from those sinus problems without having to go through the traditional sorts of recoveries.
And who's a good candidate for something like that? Because how can people tell if their sinuses really need some serious looking into versus just a constant cold or stuffiness?
Well, people who are either getting recurrent infections or chronic infections, so headaches and things like that that are just happening on a constant basis, or just a constant stuffed up nose. If you have to think about your nose, if you have to think about your nose often, there's probably something that we can do to help with that. The sinuplasty, as far as one example of what we can do, allows us to help people very minimally invasively to help their problems and not have to have them rely on medications for the rest of their lives.
A lot of people, I think, worry if they have to have some kind of sinus procedure done, especially if it requires surgery, about that recovery, because you hear about the nose being packed and how comfortable that is. Have things changed?
Absolutely. Yeah, not just with the sinuplasty, but even with traditional techniques, we're able to do things with a lot more finesse. And the finesse allows us to, for instance, I can't remember the last time I've had to pack somebody's nose after surgery, whereas traditionally, back in the day, that was always the case. So the recovery on all phases has gotten a lot better. And then with the sinuplasty, we're not removing any tissue. We're not doing anything that really requires a lot of invasive work. So it's very, very minimal. I've had most people who have just had sinuplasty are able to get back to work or school the next day.
Wow.
And is this part of new electronic technology being used in your field? And is there other options for people?
Yeah, I mean, I'd say, as far as electronic technology, I can maybe let Gwen talk a little bit about that.
Electronic technology that we've tried to bring to the office really starts for the whole patient experience. So when they first call our office to make an appointment, we give them a code that they can go onto the internet and do all, the traditional paperwork, all the forms, that sort of stuff. We can get all our information that way. And
so you're not sitting in the office.
Exactly.
Yeah, doing
exactly.
Nice.
So it goes right into their chart, so it stays really accurate too. And from there, after the appointment, after we would see them and care for them, we're able to fax their prescriptions to the pharmacy of their choice while they're still in the office, so there's no waiting on their end, when they get there, to keep really efficient. And also, we get those letters back to other doctors that need that information that same day, even while that patient's still in the office. So it just goes right out using that whole electronic system.
Nice.
And Dr. Gwen, your specialty is hearing loss.
Exactly.
So what are some of the advancements when it comes to your field?
Well, hearing aids themselves have become very, very fun. They've gotten a lot smaller, and they've really solved a lot of the problems that people have had with hearing aids in the past. We all know people that have put their hearing aids in the drawer and just have been really frustrated with them, but the hearing aid manufacturers have really heard, you know, what the problems were, and they've responded by making this new technology. One of the things that I get most excited about are the hearing aids that automatically they adjust to whatever situation you're in, and they've got maybe 7 or 8 different settings, and they're constantly taking in what sort of sound setting that you're in, and they make adjustments automatically for you that way.
Yeah, because I always remember my grandparents just, you know, always cranking their hearing aid.
Yeah.
And a lot of the advances are in the testing part of it as well, right?
Yeah, especially with hearing aids. One of the things that we've started in our practice is we've set up, it's kind of a virtual reality sound suite where we're able to really make, you know, or simulate those environments that people are having trouble in. And with the hearing aids, we do a lot of fine tuning. So people can have their hearing aids on, they're wirelessly hooked up to our computer to make the changes. And then we can turn on those sounds and see how they're really doing and check how those hearing aids are working that way. So,
Unbelievable.
yeah.
Dr. Madan, talk about pushing the envelope in the practice that you guys have together and what that means.
Yeah, I mean, really, our whole purpose for being, since we started this practice, we started the practice together, and our goal was to do something different. I mean, there are other ear, nose, and throat physicians, other audiologists around, but what we tried to do was to leverage technology, both as far as medicine and the hearing side of things, but also kind of what we were talking about before with electronic medical records, things that there's a lot of talk nowadays in the press in general about how medicine ought to be transformed. We're trying to do it today, and we're trying to do that on a facet by facet basis.
Because that saves patients time, it saves them maybe money too, and it's a great benefit maybe that you don't see in a regular office.
Right, it's better care, bottom line. You know, for instance, when people are entering their information and that information comes in once, when I send a prescription out, that prescription gets entered once, there's not a lot of loss in translation. And so there's little things like that when you combine all those things together, makes a big difference.
It was so nice to talk to both of you. Thank you so much for being here and talking about all of these advances. We want to make sure that people know how to get a hold of advanced ear, nose, and throat specialists. Your office is located in Wauwatosa on Mayfair Road. The phone number is on the screen. The web address is there as well. For more information, it's advent.md. It was a pleasure talking to you. Thank you so
very
much.
much.
Thanks for being here.
Coming up, a group that is offering great support if your resolution is to run a marathon. In the